Diabetes mellitus is a commonly prevalent chronic non-communicable disease, and its burden has risen to over 8.5% globally, with a particularly steep trajectory in lower middle-income countries, especially in South Asia. Community studies report a prevalence of 11.4% in Bangladesh and 16.7% in Pakistan. People with long-term physical health conditions, including diabetes, have a 2 to 3-fold increased risk of depression. Depression and diabetes multimorbidity significantly contributes to global health and socioeconomic inequalities. Outcomes for depression and diabetes are significantly worse for both conditions when they occur together. Depression alongside diabetes is associated with a 1.5-fold increased risk of mortality, impaired diabetes self-management, poorer glycemic control, increased risk of diabetes complications, and longer duration and recurrence of depressive episodes. It also increases diabetes healthcare costs. A joint approach to care is needed using a scalable intervention to recognize and treat depression integrated with diabetes care. Behavioral activation is a relatively simple, effective, and culturally portable psychological therapy for depression. During depression, people may face difficulty to lose interest in doing tasks that are important to them. Behavioral activation, a psychological therapy that can be delivered by non-specialists, includes scheduling activities and monitoring desired behavior. It enables them to understand their changed behavior and its relationship with their moods. BA helps to restart or take up new activities that are significant to them.
Our aim is to develop and test a culturally appropriate approach to the recognition and treatment of depression in people with diabetes in Bangladesh and Pakistan. This is going to be based on behavioural activation. In order to do this, I'm really pleased to launch our 4-year NIHR-funded research program called Diadem.
Developing and evaluating an adapted behavioral activation intervention for people with depression and diabetes in South Asia. In this 4-year NIHR Research and Innovation for Global Health Transformation program, we will develop a culturally relevant, scalable intervention delivered by non-specialists integrated within diabetes care. This will be achieved with the help of interviews, literature review, consensus development, and co-design to adapt behavioral activation for delivery alongside diabetes care in Bangladesh and Pakistan. Use decision modeling and value of information analysis to inform the design of a trial of Diadem. Test the feasibility of Diadem and develop procedures for a full trial evaluation. Evaluate the clinical and cost effectiveness of Diadem versus optimized usual care. Estimate the economic impacts of depression and diabetes multimorbidity. Enhance LMIC and UK research capability in applied mental, physical, multimorbidity research and policy making. The program is led by University of York and Hull York Medical School, United Kingdom, while our collaborators include TEAS, ESK and AMP, Wear Valley, NHS Trust, United Kingdom, Rawalpindi Medical University, Pakistan, Institute of Psychiatry, Pakistan, Khyber Medical University, Pakistan, Hayatabad Medical Complex Hospital, Pakistan, Diabetic Association of Bangladesh, ARC Foundation, Bangladesh, University of Southampton, United Kingdom, University of Leeds, United Kingdom, University College London, United Kingdom, and World Health Organization. Community advisory panels comprising of people with mental physical illnesses, caretakers, and organizations that advocate for them will be fully involved at all stages. We will also build capability in applied multimorbidity research and policy making through experiential learning, doctoral fellowships, bespoke training, and research policy forums.
Diadem has the potential to improve mental and physical health, to reduce inequalities and stigma for vulnerable groups, and to provide economic benefit for them. Building on our existing collaborations, the program will also enhance capacity in applied mental physical multimorbidity research and in policy making.